talk a little bit about the support that a hospice team provides and what they don't do.
So right on. So the hospice is an amazing thing, amazing, wonderful service. So lots to say about hospice. It goes back to the 70s in this country. The Medicare hospice benefit came online in the 1980s, and it's a very special. It was and relatively still unique in healthcare as a bundled suite of services. So with hospice, you not only do you get the medical support of a doctor, but you get a nurse, you get a social worker, you get a chaplain, the volunteers. Hospice programs will often have things like art therapy, music thanatology, speech therapy, PT, OT, like we were saying earlier, physical therapy, occupational therapy. There's a large family of people, of professionals that can help support a person and their family. And it takes that much work. So hospice is a way to get this interdisciplinary mode of care. The expertise is around helping you and your family feel as well as possible. So symptom management, communication expertise, making difficult decisions, supporting your family through the dying process into the grief process. All of that falls squarely in the hospice mode. And the great thing is, in this country, you can guarantee yourself hospice as long as you qualify. You have to have two doctors to say you have 6 months or less to live should nature run its course. So if you qualify, hospice is bar none the way to get the most services into your home. Most hospice care takes place in a person's home. So it's a wonderful thing. But it's still inadequate. So one thing to clarify here is, with hospice, sure, you get 24-hour a day telephone support. Something goes on in the middle of the night, you can call the number, you can actually speak to somebody. You have this big team checking in on you. But the average routine is, a nurse, so doctor in the background, nurse coming out a few times a week, and social worker or chaplain as needed. Maybe a home health aide for an hour or so a day to help with daily sort of caregiving needs. But that still leaves 20 plus hours any one day without the hospice in the home with you. So still a lot of work falls to the family and friends and the patient themselves. So keep that in mind. So hospice is amazing, the most comprehensive suite of services you can get into the home. But by itself, it's oftentimes not enough. You're still going to need to be work for family, friends, and patient.